So this is a fun little collaborative podcast between the Prediction Health and ScholarRx teams. We've got Justin here with me, and he'll introduce himself in a second, and then I'll introduce myself. But we're going to dive into AI and some updates on sort of like where it is. There's been a lot of really exciting advances recently, and then talk a little bit about how that applies to healthcare, specifically things that we're working on at Prediction Health in PT and analytics and helping with compliance and efficiency. And then, of course, the medical education space. So, Justin, if you wouldn't mind introducing yourself, and then I'll go.
Yeah, sure thing. And appreciate the collaboration, Pedro. So, hello, everybody. My name is Justin Klutka. I am the Chief Technology Officer for ScholarRx. My background has primarily been in education technology and more recently here with MedEd with ScholarRx. So, really looking forward to talking about AI today.
And I'm Pedro Teixeira, CEO, co-founder at Prediction Health, all-around nerd and MD, PhD. And I really like AI. I like using AI to help build useful tools, and we do a lot of data processing from EHRs, EMRs, pulling it out, doing useful things, and we'll get into that later. But I guess we're starting off with the whirlwind of crazy updates in AI land. Um, so I think we've both probably seen like different pieces of it, and there's so much stuff coming in that you can't really keep up with a fire hose. So if you want to share a little bit about like the things that you've seen recently that are the most exciting, and then I can share a couple items that I've seen too, and then we can start picking them apart and seeing how they apply to meta ed and also to healthcare.
Yeah, and Pedro, I definitely agree that what we're experiencing right now is absolutely a hype cycle. A lot of people are debating, is this a major breakthrough? Isn't it a major breakthrough? But one thing I can confirm is it's definitely generating a lot of hype. Like AI is showing up in conversations that it never would have shown up in even 2 years ago. So, you have people in grocery stores talking about AI. So when you start seeing those sort of things, you know that the technology has made its way to the dinner table conversation, and it's starting to show up in a lot of different places. And for me, I think I think what we need to figure out now is how to take what is going on and it with the hype, with the breakthroughs, and apply it to these different domains. So that's what I get interested in is figuring out, how does this help solve a business problem? How does it help solve a productivity problem? And I definitely think there are things we're seeing today that are going to help in all of those areas. So I'm a believer. I just also think that there's been some very strong and powerful hype put behind this most recent push. What do you think?
Yeah. Yeah. That's a really good point though to call out the hype piece, right? There's a lot of noise almost. And I agree. I think that it's indicative that there is serious advancement being made and there's really cool stuff here tech-wise. And it also lends itself really well to like hype, to like being the shiny, like dazzling, sparkly thing. Um, and sometimes the dazzling, sparkly thing is not does not mean that there's a lot behind it, but I think this time there is, and I think um, you're seeing like a lot of useful, interesting things come up, and how it aligns to what you can actually get done is super important. I noticed a question or a comment from somebody, especially like right after GPT-4 dropped. They're in NLP, like an NLP like grad student, and he said something along the lines of, "What what are we going to do now? Like we've been working on these things forever, and this thing seems to just kind of like come along and just quickly like smash a lot of these different tasks and NLP challenges." And of course, it's not perfect yet, but we're on four, and three was way better than two, and now four is way better than three, and he can see that another one's coming out. And I then sent a quick little response back and like, hey, part one was get something that works so that you could do part two, which is now apply it to doing something useful. And so I totally agree. Right now, it's about figuring out what are the applications, because once the like hammer works, it's a tool. You've got piles of things that you can do with a hammer and a lot of opportunities to help improve things with a great, useful tool that hopefully just like works for you, and you don't have to spend all this time and effort like actually getting the accuracy and performance up to the point where it is useful. You got like that first step up, which is exciting.
Yeah, I completely agree. Pedro, I'm curious. I think we should talk a little bit about some of the applications we see in medicine, medical technology, med ed, higher ed. Let's go there. I'd like to come back to the conversation of what does it all mean for the workforce, but I think we should talk about some of the projects or updates that we're seeing in both of our domains. Would you like to go first?
Yeah, no, I would love to. So we at Prediction Health, our like specialty is going through the EMR, the EHR, where there's lots of unstructured data. Unstructured data meaning people just type stuff. They're sending messages to each other. I'm sure you've gone to the doctor's office and they're writing their little note and often like very distracted, right? And they're putting information in there, but it's not clean by any stretch of the imagination. Everybody types things their own way, like, oh, Joe's pain is worse today. And then someone else somewhere is like, oh, James is feeling better, right? It's like, okay, well, pain's worse, feeling better. Like, what's the number to compare these things, right? And there isn't really a clean way to do that right now. So we use AI and ML to process all of that text, every single sentence, to try to turn things into numbers, specifically for physical therapy and this big compliance challenge they have, because they have to write their notes a certain way. And right now you have to have another human go spot check some of their notes every year to then give them feedback and like, oh, I looked through these 6 cases and you're actually doing all of these things like that are either you're overdoing it or underdoing it. And then people spend a bunch of time extra writing everything into the note because they don't want to miss something. And then that's a waste of time. So anyway, we pull in all of this data and then we turn it into nice graphs and numbers and things so people can track and just zoom into it. And since it's AI, instead of a human spot checking, we can run on millions and millions of notes, like every single note, every single sentence. And I think that this like black box nature of the EMRs and the EHRs is the biggest initial thing to solve so we can improve healthcare. If you want to make something more efficient and better and higher quality, you want to ideally have like a number that you look at, every day or every week. You're like, hey, how do we do this week compared to last week? What can we try? Did it get better? And if you can track it and like make those numbers go up, then that's awesome. That's how you make progress. If it's a big black box, you have no number. So you try things, you don't try things. How do you know if you're going in the right direction? Because sometimes it's really complicated. And that's what I think that we can move towards longer term with this initial application, right? Give people a number to track for care quality and efficiency, and across many different specialties, eventually beyond PT, with AI as the useful tool that can do the analysis and give back a number from very, very messy data.
That makes sense. And what are some of at the high level, the baseline technologies that you're using in order to accomplish that?
Yeah. So there's been a lot of stuff over the last couple of years, but it was way slower development wise. But there are, of course, more like classic NLP tools, but now done with ML. Things like finding medical concepts, finding if they're negating meaning, no, they don't have nausea versus like, yes, they do. So like concept indexing stuff. Then you have even just splitting sentences. People don't appreciate. They're like, oh, period, and you split it, and it's a new sentence. That in and of itself actually is very challenging to do well because, well, what about the question mark? What about the exclamation point? You're like, okay, add them to my splitter. Like, okay, cool. What about when they don't do a good job? What about outlines? What about when there's a typo? What about when the period is in there because it's, Mr. Jones? So anyway, even super simple stuff like that traditionally NLP would use all these different toolkits to try to do, ML is coming in and just like absorbing these tasks and allowing you to hit a higher accuracy, but also really heavy because it's much heavier than a lot of things folks would used to do. And then, of course, classifiers, categorizers, where we're able to like look at a sentence and be like, okay, well, what is this? And like, what do we need in this note to be complete? And being able to do all that categorization, classification, and like extraction and summarization. And then the new models, like ChatGPT, can do a lot of those tasks. But the really, I think, exciting thing for a lot of people is that it's a generative model. So it will generate content. So you can ask it a question and it'll like generate an answer. And that's something that we've started making some progress on too for the next stage, which is like find the problem, tell people like what the problem is and help them track so they can improve it. But then ideally, can you help me? Right? Like you said, this is bad. What would have been a better version? And that's where you start getting into the generative side, where we're going to start, I think, really scaling up a lot of stuff there, which will be exciting because now it's a way to help people by kind of doing a version for them and giving them at least a draft to start from. That'll be really fun. So that's kind of like the whole spectrum of tools that we use on our side for for the different processing tasks, and then sort of like a glimpse into the future for what we'll be using AI for next.
That's great.
So how about you all, right? Medical education, so many challenges there, so many things to do, and you've now got this explosion of tools. Would you mind sharing a little bit about all the different um, like things and tools that you're applying now versus like would like to be applying in the near future, or other opportunities in the med ed space?
Yeah, glad to do it. With at ScholarRx, one of the major value propositions for us is to bring very high quality and modular content into the medical education field. We refer to them as bricks because they are so modular. They can stack on each other. They can be combined. And what we found is, so we kind of come from a place of respecting content being modular, fresh, approachable. And so this is where we see some of the AI capabilities starting to come in to accelerate that. So, and I want to be pretty clear that we are a believer that high quality medical content is going to involve like a human in the middle, that expert, and being able to provide that expert in the middle. It has to be part of what we do because of what we do. But we do see these generative models as a way to jumpstart that content creation process and keep it fresh, introduce variability where it's needed. Because you could just imagine, if you're trying to study a concept, you could benefit from studying that concept in different ways, approaching that concept in different ways. And one thing that we're finding that generative models are very good at is giving you different looks on the same subject, and it can do it pretty quickly. Now, again, you have to confirm that it's accurate, and that's the important part. But it can produce that variability pretty quick. That's one area. The other area, and we've worked closely with you, Pedro, on this, is this concept of the curriculum map. This idea that medical education is taught towards specific journey or a map, if you will, and people in the education domain will understand that. People not in the education domain will hopefully in their mind's eye envision like there is a journey you want to put these learners on, and you want them to make specific stops for certain durations in order to accomplish that end game of being skilled at what they sought out to learn. Well, the idea around a curriculum map is an abstract concept. It's something that it can vary from med school to med school. And I see AI as an opportunity to sort of evaluate these various curriculum collections and maps, if you will, and help articulate like what might actually be the one true map, if there is such a thing. And I think that's another area that, and we're in the early days of exploring, but I think those two, between content generation and the curriculum mapping problem space, are both very interesting from an AI perspective.
Obviously, we've known each other for a while and we've talked about this a bit. And there's like this two map. It's like a two map problem. Those two things, right? One is the map of the content that I have, and then there's this map of what does the learner know, right? What does the medical student understand? And those aren't perfect, because if they were, then they'd be done, right? There's like changes between those two. But one is like, here's content that I have in front of me. And then the other one is like the stuff that's in someone's brain. And yeah, I was just kind of wondering, like, are there things that you are sort of now thinking about that are different about, how do we match now and do the learning and do the most optimal path for them to learn, that now is sort of different because of the AI technology, because of this, like, we can generate bunches of stuff, we can analyze bunches of stuff. But the fundamental problem at the end of the day is, you don't know this fact. This is an important fact from my curriculum map. Like, I need to make sure that I convey and fill in this gap in your brain map of medical information.
Yeah, I think it's interesting because, well, I have no background in medical education. I haven't ever studied medicine myself. So, but I've been a student and I've been a learner, and I understand like how, there are ways to learn effectively, and there are ways that aren't so effective. And I think that the major thing for me with these technologies, what it's showing me at this stage, is that iteration and discovery are very important, but these are also things that AI is now proving to be quite effective at. Like just the amount of improvement in the way it can assist in cycle time. So to go back to your question about the map concept, I think it's going to be one of those things where it will require some iteration. It will, and at ScholarRx we could start by looking at our own content, as you mentioned, and evaluating, what is that map? What are the learning objectives that we cover? What are the concepts that we're covering, and what's the journey look like? And by perfecting something like that on our own content, we could then take it to um, different entities, institutions, and perform that same service for them, and not only sort of map their information or their content, but we could then find the relationship between our content and their map. So it would kind of show scenarios where certain concepts might be too light in some areas, or perhaps there's this belief that the curriculum is very focused on a certain topic, but lo and behold, it doesn't really. It's actually spent more time on certain types of treatments or other areas. So that's where we're hoping it goes as we kind of continue to iterate on it. But I do think at this stage, with the rapid pace of technology improvement, it is all about being able to build these iterations in and test and learn as quick as possible.
This sort of discussion about learners in medical education just sort of reminded me that I've actually used ChatGPT now a few times to learn stuff myself. And that was just like a really killer experience, because sometimes you'd ask a teacher, but maybe be too shy to ask a question. Like there's not really that feeling of shyness. You can just kind of dive in and be like, oh, what is this? And like, how does that work? You have to be careful because it maybe is telling you something that's not accurate sometimes.
Yes.
There's some danger there. You have to do some double checking. But I thought that was really cool. It was kind of like a personal tutor where you don't have to feel like silly because you're asking a question that you feel is, dumb.
It's yeah, I think that makes total sense. I have used it to learn a couple concepts myself. In particular, I've tried to pick up programming languages that I have no prior experience with, and it's quite effective at helping me draw parallels between things that I know and the new concept. But one thing I've noticed about learning from a generative model is, at least for me, I start to approach it totally from the goal of, I'm just trying to teach myself something as efficiently as possible. And, we see that take place in short form videos and things like that. I mean, people have been doing that for a long time. That's why, certain video platforms have become so popular, because they're so approachable. You can learn something quickly. But I think these technologies are helping, move from this idea of, well, I just need to sit down and read this book, and hopefully by the end of this book, I'll understand how to program in a certain language. But instead, these models can help me figure out, well, what does a if statement look like in this language? Or, how do I write a loop that looks a little bit like this other language that I know? And it can help me get there pretty quickly. So that's one thing that it's done for me when I think about, my approach to learning.
Very nice. Yeah. I asked, actually, a lot of it has been programming on my side too. And there was something where it did it in Python and it used like the any call. And I just was a little unsure of why it did it. And so I just asked, like, hey, why did you use that .any? And it was like, oh, well, this is a list of nested lists. And therefore, to do the task that you want, you have to query the list within that. And I was just like, wow, like that's really nice. Because otherwise, what I would have done is go to an interpreter, run the code, look at the object, try to understand what's at that level, right? Within like the 20 lines that it spit out really fast. And instead, I could just ask it, like, why are you doing it? Like, oh, okay, that makes sense, in a very natural, like human question asking way, even though, it's not a human.
Yeah, I particularly like the ability to ask it, hey, that didn't work. you know, it didn't work, and this is the error message I received, and it'll, make its best attempt at course correcting what I did. So I find that pretty effective too. It again, it's efficient. If it's giving you correct information, which is always going to be the concern, it's definitely more efficient that way.
I really wish I had this in med school because I went through, I did the whole thing, and it's a grueling path. and you spend most of your time just kind of trying to memorize a lot of stuff. But since I knew I was going to go to grad school for that chunk in the middle, I knew that if I just tried to memorize everything, I was going to forget everything and then come back into the clinical setting and be in a really bad spot. Right.
Yeah.
So I know that if I understand how something works, that I'll retain it much better. So when I could, I really tried to understand, like, okay, we're doing this, but like, why? Like, why are we doing this? Why does this work? Why does this medication help, with this disease? And really try to understand like the mechanism behind it. And one of my probably most common searches, if you were to go back, was just like, what is the mechanism of X? And a lot of times we don't know, but often we do, right? But like you have to go like dig around and search for the information, and then it's not always very clear. And then you're like looking at a sheet and a biochemical pathway and everything. I just think it would have been so useful to make that a lot easier to understand like the why. If I could have been like, hey, ChatGPT, I'm trying to learn this. Why is this drug doing this thing for this disease, in the pathway? And just been able to interactively really, really go through that because I think a lot of folks would benefit from this, but there's so much work you have to put in to dig around and find the information and then put the answer together for yourself. And maybe that helps you remember too, but then you're going through a much smaller portion of the material to the level of like, oh, I really, really understand this, and not just like drug medication name, or drug, disease, like use this for that.
Yeah, that's a great point. And I think this is a good opportunity for us to discuss like how we see some of these things playing out in the let's call it the job market. Maybe we should go, if you want, we could go back to the example of the physical therapy scenario that Prediction Health is looking to solve. How is that going to boost the experience for the various people or the various roles that are involved in that life cycle, if you will?
Yeah, and that's a really good way to think through it, right? Because everybody, I think, different roles are getting different value from the thing that we built. So simply, we have right now, we connect to the system, we pull all this data in, all the text and every single note, and then we run all of our different AI models on it. And then the thing that we give back to people are these dashboards where we try to really simplify and clean things down. And that each dashboard then is assigned to a thing that people value. So if you're a practice owner, we have a kind of general metric section where we've pulled everything in, and we can tell you like, hey, like here's how you're doing, here's how many visits you all saw, here's sort of like the productivity per visit. And like, okay, that's high level metrics, which some EMRs do have, right? But then we can allow you to then start diving down because we're going through, again, every single sentence and every single thing. So now for that practice owner, they're getting a lot of visibility, right? That they're being able to like answer certain questions with visibility into the level of like what's actually getting written. So if you want to know something like, hey, we do dry needling at our site, and there's a lot of complicated rules around whether you can bill or can't bill dry needling. Well, now we're able to pull in and read those notes and find those medical concepts, and we can give them back these dashboards like, here, here's the percent, here's who's doing it, here's how often, here are the different patient types, right? Are they doing it for this type of problem or that type of problem? Can I search by or filter by ICD-10 codes, right? Because I want to know like this type of patient, what are they getting? And we could do dry needling, but we could do the thousands of other treatments too, right? So visibility, and then being able to go drilling down and answer very specific questions for a practice owner. Different role are the compliance folks, which of course the practice owners care. Are we getting more compliant over time or less? Are some therapists doing really, really well, but then some therapists have really bad compliance scores because, maybe they just don't know, they need a certain section or something. But then the compliance officer really, really has to care. And at the level of not just, I looked at one note or one episode of care for this therapist, this month, but rather I get the data from the system that looked at every single visit and every single episode of care, ranks and sort of has those scores. And then I can dive in like, hey, this person's having a challenge. Like, what is it? And they get to zoom in and understand like, oh, the sentences that are missing. Like, hey, this person, they're maybe not providing a good assessment and plan sentence, or their goals, they're doing like one goal and the goal is not measurable and actionable, which therefore makes it like a bad goal. And in physical therapy, you of course see the patient, and then you're choosing your goals. Like, I want you to be at like a 2 out of 10 pain level when you are walking, and that you are able to walk for over 30 minutes at a time before needing to take a break, right? So you set your goal, and then they're selecting the activity or intervention And there's manual therapy that they'll do. There's different exercises that they'll do. They'll work on blood flow and flexibility and strength and coordination. And then that is to improve the goal. And since the goal is written, right, you're in a tricky spot where a lot of this is just typed out, and you don't know, like, are we making good progress? Are we not? Sometimes people will do it as percentages, right? Does it make sense that you're doing this for that? Right, is the kind of thing that we can start assisting with as well. Because if you've got shoulder pain and you're doing squats, well, that would be a little disjointed, right? But you can't read every single note. So owners, the compliance officers, compliance, chief compliance person, right, at the site gets a lot of support from this. And then for therapists, would they get scorecards back? Because again, you're like, okay, I'm busy. I'm taking care of all these patients. I have lots of folks that I'm seeing. Maybe I'm doing a really good job. If I just, don't know that something in the note was kind of off, if I get audited and then I'm going to get in trouble later, like that's not good. I would rather know sooner, in the scorecard, which we break it down. We say like, hey, if you were going to just focus on 3 things to improve, here are the most important 3 things for you to improve. And then we can link it back into like the note, the visit, like what's missing. Like, oh, it's your, subjective, you're just, maybe you're a little too much. Maybe it's over documenting, and you can now know like, oh, I can save like 10, 20 minutes a day because I don't need to do this much in my subjective, right? Like I'm doing 40% more than my peers in this section. Like I really don't need to do that. I can chop that down, save myself time, still do a good job, right? And that's available in these like direct feedback things. So like across those 3 personas, that's kind of some of the stuff that we do.
Yeah, what I really like about this, Pedro, is I get the sense sometimes in the medical space that there's this desire to over codify a lot of like the entire experience, like what the patient said, the treatment, the billing code, like all the way through. There's this desire to get to a codified item, but I'm sure somewhere in there in that codification, like the verboseness of like a human trying to be complete gets lost, right? And I hear a little bit of your solution helping kind of find the balance of being able to put a complete note in and not be so worried about like, well, I would share that information, but I don't want to like spend too much time on this task because I know it's just going to distill down into this code or something like that. I'm hearing that there might be a balance, found here, allowing the human to continue to provide the detail, but still get the quantitative data on the other side.
Yeah, we have a couple of these. They're like Goldilocks problems, right? This board's too hot, this board's too cold, this one's just right. And this particular, Goldilocks problem is you've got very bad compliance because not a lot of stuff are documented either at all or not documented in a way that is defensible. And then we've got everything. It's super, super compliant. It has everything that you need. But along that continuum, you also have like you wrote like everything. You wrote a tome. You have a whole novel versus like you wrote very little. And the optimal is like write, as little as possible while still being thorough enough to give good care. And you don't want to go too far in either one of those directions. And then the more that you type, the less time you have to do other more productive things. So we don't want to just type for the sake of typing because we're worried about compliance. So we track both of those so that we can help, because a lot of people are compliant, but they're writing way too much and they're over documenting. And then we have metrics around like when are they signing off on their notes? Because some people 2 a.m., 3 a.m., they're signing off notes, or end of month, they're catching up and they're writing a bunch of stuff. Like they're going to get burnt out. And a lot of people are getting burnt out in healthcare. A lot of it's because of these admin type things. And other folks, they go the other way, and like there's too little, but we can give them really targeted feedback. Like, okay, like you have these pieces, you just need an assessment plan and your goals, you're doing 1, or you should be doing, 3 to 5. But some people do like 20 goals. Like that's unnecessary. You don't have to, do that, right? So it's like this intersection between two Goldilocks problems, and going too far in any direction is not good, right? So that's very true, right? They're balancing off each other, and we can quantify both so that you can try to get to this happy medium, where it's enough, it's good, but it's not so much that you're tired and wasting hours per week typing extra stuff that you don't need to.
Yep. Makes sense.
So I would actually love to get your thoughts around, like, if you jump like really far, like, well, really far is hard when things are advancing really, really fast, but even a couple years, of course, you want to augment editors now generating good content, confirming the really high quality of content, because this is stuff that medical students are learning to then apply to real patients in real life. And you want to make sure that those things are correct. We also talked a little bit about like interactive experiences, which is kind of like an AI tutor. But now an AI tutor and something really interactive, you're not going to be able to have an editor in the loop. And I'm just kind of wondering, how do you think about that space? Because there seems like there's a lot of value there, but also a fair amount of risk and challenge in pulling that off.
You know, trying to look down the road, I think that one opportunity is to just really level up those content editors who already have sort of like a special approach towards creating this type of content, because the medical education content, it does take a certain type of content producer. It definitely takes a certain type of expertise that you can't just find anywhere. And I think that AI can certainly help fast track that, and it can certainly help that person who is quite skilled or gifted at creating those content, that type of content. It can level them up and help them produce more. If we go further down the road and we start thinking about you know, tutoring offerings or things like that, my opinion is, and this is where I'd love to get your views on this afterwards, is I think it will be essential that whatever model and data that would be supporting that tutoring experience has to have baked into it a couple things. It has to have the expertise of those content providers that we just talked about. It still needs those skilled people to inform, help with the training, the feedback, to ensure that model looks, feels, and reads like a ScholarRx tutor. Because if we don't achieve that, then it's not us, and that's what we need it to be. And then I also think that it has to have the right sort of content used to inform it. And my understanding is that as long as that content were to kind of follow our guiding principles of approachability, modularity, shareability, that kind of thing, that it would also then be the type of tutor we'd want it to be. Because I think if you just took plain old content off the shelf and trained it that way and just standard English, you kind of get the ChatGPT experience now, where it doesn't have that style to it. You could tell it to attempt a style, and if it thinks it understands that, or if it thinks it can quantify that, it'll give it its best shot. We've seen that. We see it both in funny and real examples. But I think on our side, if we were going to do something like that, it would require a highly kind of fine-tuned, trained model that's been governed by like everything that goes into ScholarX content production. So that's where I could see it, if you're asking me to look way down the road.
I thought about this a fair bit because, of course, our use case has this subject matter expert. In our case, like the compliance officer is one of the really key roles. And I've also thought a lot about, in Google and our experience over the many years now, because Google's been around. Google's like just a standard thing now. Oh, I'm going to go Google it, and you're going to get some sort of like information out, right? And a limitation with Google applies here, I think, because it's like the same thing, because it's trained on a lot of internet scraped data, some more proprietary, but a lot of it just like scraped. So for Google, I would often see that if it's a quick question and it's like, the complexity level, like I'm going to go and scrape the surface, or I'm going to go like one level deep, it's a lot easier to find with Google. But if I start wanting to get something that's more specific, something that requires more expertise, right? Like I want to know about a tax question that applies to people that live in, New York State, law, right? Then you very rapidly get way less information that you can find, which I think therefore then leads into what you see in ChatGPT is that for general stuff, it does really, really well. If you start really pushing on the boundaries, though, with regards to expertise and things that are rarer and that aren't as readily available just like on the internet, it starts having some challenges. It can do still really well, kind of getting you like in the ballpark, but that's kind of like where you're more readily able to find a boundary. So I think for your use case, for most people's use cases, if you want to get to the boundary and really like deliver value, it's going to be in do what what custom expertise do we have that's not something that you can just go search in a Google, to find the answers to it? Because if it's sitting there, then like, you're gonna get run over real quick by ChatGPT. But if you have expertise that's harder to find, or you have style, or you have effort, or a really high bar for quality, because I know they're doing a lot to improve their data set going into training these models, but it's so much data that it's not going to be perfect yet. So if you're reviewing with experts the quality, I think there's a lot of value to be provided there as well. And so it's like expertise, it's like the quality sort of confirmation. And then I think one of the other really important things for companies to add on top of these AI models is the understandability, which means I give you an answer back, and you can ask it, and sometimes it'll reason, which I really love. It gives you, hey, you're asking about this, and because of these reasons, this is the answer that I would give. That's actually chain of thought reasoning, which helps improve the quality of the model, which I think is really fascinating too. But it does give you some explainability. But I still think that there's a gap, and especially in high risk domains like law, like healthcare, and even like medical education, that there are gaps in the confidence that you can have. And I think it's going to be very key for people to fill in those gaps. Because if you're not, then the user has to do a lot more work. Like in the case that it's off, and they're not able to quickly verify or understand like what happens so they can figure out that it's off, like that's gonna be a problem. So you need to kind of fill in that gap. And it's gonna be, here's why it did it. Here's visualizations as to why. Here's the reference material that it's coming from. If you have really great reference material, you can just kind of make the relevant things available immediately there. I think that'll help a lot. But like there's a trust component that you've got to fill in by making the content, and the reason that the content is what it is makes sense to the person using the product. Yeah.
Yeah, that makes complete sense. I think about as search engines, began to become very dominant. You always knew people who were a little bit better at wielding them than others, and I think what some of these technologies are now doing is that one or two follow-up search that you would have typically have ran has really started to be replaced by more of a conversational kind of interrogation of an AI model. And I think, to your point, if properly, crafted, I do think that's going to become a far more just natural experience for seeking out information. And then I think being able to surface supporting information for what it's saying, search engines had to do the same thing, like that's, what's the credibility score of this? What's the algorithm, so to speak, for it to be at the top of the list versus the bottom or not there at all. So I think these models also have to go through their own sort of proof points where they have to surface this information when they give an answer, particularly if that answer has to do with something sensitive like medical education. So yeah, I agree.
Yeah. I do like the way Bing does it, because they actually have the citations in, which ChatGPT doesn't have. Like ChatGPT may give you things that look like citations or references, but a lot of them are just hallucinated. Some of them are right. A lot of them are hallucinated. Bing actually includes like the nice little citation, which is great and helps a lot. And then you can kind of double check it really easily. But there's still like a gap there, because I still have to think that I'm going to go double check. I have to click, and then I have to go to the page and kind of figure out what it is. So there's still, I think, progress to be made there. But yeah, I think it's pretty critical.
Yeah, and I mean, I think I like to talk about the like where's it going to go kind of step, and I do think it's in that era now of things. Companies like Microsoft are supplementing the results of these models with additional information. I mean, that it's the attachment of additional information or the integration of other systems. So the model has a response, but there's a search system that's coming in and helping support the things that model might be asserting. And I think there are a ton of other systems that haven't even been brought into the mix yet. And I really see, me personally, I see that's how this technology starts to advance, is the creation, integration of additional systems on top of it to help kind of augment what it does. versus it just getting better at what it does. So that's my view. I'm not sure. You may have different thoughts, but where do you think this? How do you think this thing actually advances?
Yeah. Yeah. I mean, this we touched on this earlier, kind of pre the recording, right? But there are these next levels to be stacked up on top of where we are. And we have these models now that are actually getting really, really good. But at the end of the day, they really still seem like they're a super fancy calculator, like a really, really fancy one, but a calculator, right? Because you're giving it an input and it's doing a bunch of calculations and you're getting an output. And the output, it's not just a number, right? It's like way, way, way more advanced. But that's what it is, right? Input to output. And I think a lot of the progress that we're going to see now is going to come from the things that get layered on top. And some of the things that get layered on top are going to be human expertise and human review to like verify the content. Um, but then the latest stuff from the last couple of weeks are things like the AutoGPT, this loop that you put on top of the super fancy calculator, right? So like, okay, here's a prompt, and now you're going to figure out what are the set of steps that you would do, and then there's going to be just some pretty simple wrapper code almost to call the fancy calculator repeatedly to then start doing something dynamic to like accomplish a task and do some planning and then get the results from those things that it planned to do and then keep sort of like working with that. And that's going to be really wild because now it's dynamic, now it's improving. And then the two sort of like additional fancy things that at least I can kind of see are one, well, okay, if you can start planning and doing something dynamic, then what if the fancy calculator starts doing things that improves, the original fancy calculator, right? Cleaning the data that they're using to train it somehow by doing multiple prompts from different angles and then kind of verifying or comparing them against each other, which is something that's way faster than humans, could probably do if it gets to something that is better overall, right, than the original. Or can it, since it can write code, actually change something about the training process for that fancy calculator's weights, right? So that it can do that. So like the self-improvement, like branch, and then separately, there's a little bit of a neuroanatomy tie-in, right? With fancy calculator. Okay, cool. There's dynamic infrastructure to kind of put so that we can call it repeatedly. But if you think about something that we're actually going to call like AGI, there's stuff in there that is not just going to be, I think, the fancy calculator. Like maybe if it's a massive model, it somehow, has these really fancy properties emerge just from like the massiveness of it, right? But you could also imagine doing something kind of like the brain, which is more in a more targeted way, replacing or replicating functionality that the brain has. So things like the like the emotional like motivation component, there are parts of the brain that are related to that, and like fear and attention, like there's the amygdala, there's the cerebellum, if we want to start talking about movement, there's the prefrontal cortex for a lot of executive function. That one seems like it overlaps a lot with like ChatGPT style stuff, right? But I think that a lot of like motivation, planning, self-reflection, that those things are not fully captured. And you could imagine either like directly trying to target them, or you just scale it up so much that somehow it develops that. But the objective function, the pressure you put on it while it's training, has to encourage it to develop those functionalities. And so either you go after them more directly, or you figure out some way to like kind of incorporate that into the training process. And predicting the next word seems really good for executive function, but it doesn't seem to me to give it like self-awareness if you keep scaling that up. I think that has something to do with like providing this reflective input back into the model, because we are very different than it in the way that like we are wired to like sense our environment, and like I can feel things and I have all these like needs and like physical stimuli coming in, plus I have this executive function stuff. And so I think that for that AGI step, right, there's some pieces that are missing right now that people just have by default that we don't think about because they're just always there for us, that I think have to be explicitly done, or somehow you have to replicate the need for those things in the training data set and massively scale it to get those other like modules of brain function in something like a gigantic GPT model.
That makes sense. Yeah, I think the complexity of humans when it comes to things like creativity, emotion, and others, and how those things factor into executive function and the production of, you know, content or anything else, they're dramatically underestimated when people start getting worried about these models, achieving consciousness, because I think there's so much else to go on there. But I do think there are additional systems, as you mentioned, that could be layered into this that could have it start to look and act as if it were to have a couple of those things we just discussed. So that's very interesting.
Yeah. Like you don't have to go to a person and tell them what the prompt is for the day. You're like, hey, go, you want to go on vacation, right? Like people independently figure that out. They write their own prompts. That's part of the reason I think AutoGPT is so cool, right? Because you're taking advantage of the model to now write prompt that goes back into the model. But then there's this question of like longer term memory. Because once it's run, it has no memory of what happened before. It has like a prompt and then it generates like the next thing. And you can get it keep generating stuff. But like that piece is missing. And I think that that's something that's important to specifically point out, because then people can better understand like, okay, there is risk potentially with the AI, but you have to figure out how to like fill in that loop, right? And AutoGPT starts getting us a lot closer to it. But like if the model's just sitting there waiting for you to give it a prompt, and then you give it a prompt and then it gives you an output like that, again, fancy calculator, you have to get these other pieces where not only it comes up with a prompt, but like what was its motivation even for coming up with the prompt? Because like we want things, right? We're hungry, we're tired, like help me figure out how to get this. I'm bored, right? We have all these motivation things driving us that then drive us to write these prompts for certain things if we know that ChatGPT exists, to then get something out of it to satisfy that motivation, that desire, that need. And like that's this whole thing that you could go back to neuroanatomy and be like, oh, like here, right? These things are related to it. Like the hunger center and the hypothalamus, and you're cold or you're tired or cranky, right? That stuff's not there yet, but that doesn't mean that it couldn't end up being in there, right? Which is maybe the thing that kind of spooks some folks, which not wrong. Worry a little bit about it. It's pretty crazy.
We make the comparison of, to the calculator. The calculator, it became kind of a commodity. It is a commodity tool, like the idea was get it in the hands of as many people who needed it and let them benefit from that, new tool. So I definitely agree that there are some parallels with AI here, that it's becoming a bit commoditized, and that it's showing up in a lot of different places. So one thing I like to think about is like, what is going to differentiate like one, calculator, if you will, or one model from the other, and what might inform, a business's choice in using certain models or certain technologies, versus a different one. So a lot of options out there. What do you kind of see as being, what should be on the mind of a business that's thinking about, deploying these, but they have options?
Yeah, there are obviously a lot, but I think the two biggest pieces for any sort of company that's thinking like how do we do something with AI, but then like how do we also make it defensible? Because if it's just going to get repeated by somebody else in like a week, right, it's not a good thing to pour investment into building and scaling it, right? So I think there's two main ones. One ties back into some of the things we talked about earlier with domain expertise, like the data. Like the model is this crystallized distillation of the data that it had. And it does seem like it can kind of do some minimal amount of reasoning. But if it's never ever seen a fact, and it's not a question of like, can you reason this through, but rather you need to know a fact, and then have multiple facts maybe that you're going to reason against, the model won't be able to do it. So there's this like proprietary data piece, this subject matter expertise, which you do have to go to expert stuff because that's much less likely to have been in a general data set, right? So that's going to be like one of the things is like, do we have a source amount of data here that, or can we put a source amount of data into the model that we then sort of control, that's our proprietary data? And if so, then I think that's one really big lever that you can pull. And if you can't answer that, affirmatively, like, oh, if it's like, I don't know, Pokemon, information, which is, I, I have a 7-year-old. So of course, I'm thinking about that because they're scattered all over the apartment. Uh, but if it's not proprietary data, then that's gonna be a problem, right? That's not gonna be very defensible. But then you have to think about the second order effect too, which is that is it going to stay proprietary, right? So does more usage of this thing that I build get me more data that's hard to replicate? And if you have a fleet of like self-driving cars, that's like a really, really hard thing to replicate. But if it's about a bunch of like chat transcripts with like people about general stuff and you can get them to just start, chatting with your robot to get data, then like that's a lot easier to replicate because it's a website and like getting enough initial usage to just start getting that data in. So data is the one huge lever to pull. The next sort of like really huge lever is going to be in processing cost, because there's this whole sequence of like tasks of complexity. Is like I fine tune a thing just to do a task. That's sort of like the traditional way in ML land that you would do stuff. There's also, you take a really big model that's really powerful and has a lot of capability, and you give it either few shot or zero. You do basically like what you call few shot or zero shot learning, where you can show it a couple examples to kind of give it the gist of the idea and then run it. Or sometimes you can even give it no examples and just like ask it to do the task, and it'll just like do the task. Like, here is a movie review. Is it a happy one or is it a sad one? Right. And that's the type of thing that if you just told a person to do it, they can just sit down immediately and just say, oh, yeah, this is a good one. This is a bad review. Right. These models, because of the massiveness and the complexity in them and their ability to understand language, if you just tell them in language to go do the task, they can go do it. But they're usually really big models. So you can look at like the processing cost per token, and you get to somewhere very quickly where it's, I think, 6 cents per thousand tokens for something like GPT 3 or 4, might be 4. And if you're just doing it once, you're not going to care about 6 cents probably. But if you're going to do it, 10 million times, now you're really going to care about 6 cents times, a million calls to it. And that is the other thing, is that if you can take the model and then fine tune it for your purpose, do this like distillation, or there's a lot of techniques that you can apply so that you go from the really huge model down to a small model that can get close to that level of performance. Now your barrier is cost effectiveness of doing the task, but that's only relevant if it's going to be a scalable problem. If it's something you're going to do like once a month, you don't want to go through all the time and effort in crystallizing a smaller model to do the task. You have to have scale for that to matter. But like that's the second really big barrier, is can I do this at scale and want to do this at scale and get a cost effective advantage on top of proprietary data? And if you can pull both of those levers, you can be in a pretty good spot. If you can't pull both of those levers, you can only pull one of them really hard. I think it's maybe valuable, but like it's a lot riskier. Yeah.
Yeah, that makes sense. And your comments around the cost effectiveness, they make me think about um, the tip calculator. It's like you wouldn't train a model to calculate a tip. You could, and like you could factor in like what was the atmosphere, did I like my food, like you could give it all kinds of stuff. It would be a very expensive and very wasteful thing. Like that's an example where you saw that emerge on all kinds of technologies, but like if you could just calculate it in your head, that's still probably the most effective way to do it. And you don't want to put a lot of scale and technology firepower behind it. So I do think because of the hype cycle we're in, we're probably seeing some uh you know mildly wasteful examples of applying these models where people are just like, could it do this? Well, yes, it could, but doesn't mean it should. So I think that's really good criteria for making those kind of decisions.
Yeah, totally agree. Yeah. I have one more for you. It's maybe a little bit wacky, but you asked me a question earlier about roles and like who and a physical therapy organization, and how their experience of our product is different and what sort of value there is for them. Which made me think that you all have also different stakeholders. You have organizations that choose to maybe use your content. You have the students that are learning from the content. You have instructors. You have your editors that are generating the content. Who do you think has the most, or multiple people, who gets the most drastic change to their experience because of all this technological advance and change, like positive and negative, right? But just like there's a lot of crazy stuff that I didn't 100% anticipate last year, that now exists. It'd be interesting to sort of get your take on how that changes the experience for the many different roles of folks that you all work with.
Yeah, uh, it's a great question. There are a lot of stakeholders involved in our business cycle as well, and I think some of the people who will immediately benefit from it will be the faculty and the students who use our content. Because if we go back to our earlier conversation, if we fine tune our content production life cycle to not be fully dependent on these technologies, but to integrate like those experts in that content production process that we've been using, to then scale and make that process more efficient, like we're going to churn out better content. We're going to churn out more content at scale, and I think that'll have immediate benefit to faculty and student that are using it. And then I think where we can introduce almost like real time or kind of in the moment variability, to help keep content fresh or to help with learning, things like flashcards, for example, being able to give the same concept different looks is going to help the learner pick those things up faster. So I think those stakeholders benefit tremendously. And in a scenario where institutions are trying to be cost effective, they're trying to be efficient, they're really trying to optimize for the time of the faculty. If you think about it, like they just simply don't have time to do a bunch of administration. Like these are the kind of things that I think can help get content set up, and presented to learners who need it more quickly. And there have been examples where our content is used for things like remediation programs, and students are put through that so that they can come out of that program ready to resume these very critical learning journeys. So I think that our existing content already lent itself to that, but these capabilities will help augment it. On the flip side, I think there are stakeholders that we have to consider. We can now put more support around that expert content producer. We can give them more tools. We can give them the fancy calculator, to help kind of get it there. But we have to think through all the parameters we've already discussed of, what are the right guardrails around those capabilities to make sure that it is in fact helpful and it's not wasting their time and it's not doing it in a way that, doesn't make sense. So I think those are the stakeholders that are going to benefit a lot. One comment I would make, going back to kind of the existential, like, what does it all mean for different roles and jobs? I think in any job where the output of that stakeholder was, kind of just, plain responsiveness or basic response, like those roles will be impacted, and I've seen quotes where, if you were a mediocre or worse content producer, like you're in trouble, because guess what? These models are mediocre to decent content producers. So you got to think about those items. So I think for us, we would just take our already strong content producers and try to add this into the mix. And I think for the broader market out there, the stakeholders need to be thinking through, how much effort is going towards some of these more, I'll call them mundane tasks that these technologies could help, move away. And then, those people who were previously doing them are going to have to find ways to move up the value chain and, become more of an expert or become more of a data producer to add those layers that we talked about, so they could benefit as well.
Mm-hmm. Yeah. Feels like it's going to be a really crazy, accelerated, wacky world, because it certainly doesn't feel like it's slowing down. So,
definitely not. And I suspect we'll see, with acceleration, we'll occasionally come a setback. We've seen those in the past with these technologies. They're comical in many ways. They turn into memes, like you don't want these advancements. You don't want your company to use these advancements and become the next meme of where something went dramatically wrong. So I do think people are approaching it with a decent amount of caution and guardrails. There's a lot of requests for more of that, which I think is relevant. We want to think through the ethical nature of these things and the controls we put in place. And with all that comes brand new roles and ideas where people can add value and figure out how to tune these things. So I do think I do think with these advancements will come setbacks, but will create some opportunities for businesses and people.
Yeah. It's kind of like that expertise problem, right? The reason that Google or these models have an issue is that as you go deeper, the number of possibilities expands, right? Like this, a circle this big versus a circle this big. Like there's way more surface area at the edge of the bigger circle, right? So as things get expand and you're able to do more and more things, there's going to be more and more opportunity for these like edge cases and these areas for expertise. But then you also have to figure out how to do it like really efficiently, right? Because each one of them also is going to be rarer that any one person is going to, care about it. And if nobody else cares, right, that's the fundamental thing. If you're going to have any sort of business, right, step one is have something that people care about and love and want and or need, right? And then have enough of those people that there's it's worthwhile to try to solve that problem, just because there's an opportunity cost to solving like really small problems if you can help more people. So it'll be really interesting to see how that plays out, because the opportunity is expanding, but it's expanding in a way where you have to be able to tackle it really efficiently and quickly. And these models are allowing or enabling people to move a lot faster and do a lot more interesting, complicated things. Kind of like intelligence on demand almost. But small intelligence now, but it's obviously expanding pretty quickly. So I'm excited to see how it goes, but hopefully it goes well. It's not guaranteed, but hopefully it goes well.
Yeah, I'm optimistic about it. I think that the product development lifecycle concepts will just continue to matter more and more. I think the ability to differentiate is going to come down to how well you execute on an effective product development lifecycle, because it's that test and learn mentality. It's the being responsive. It's understanding data. I mean, these are things that existed pre these technologies, and I think will just become more and more important post. And if you were ignoring them before, like this is a good opportunity as a wake up call to say you probably shouldn't be ignoring them now, because everybody just started moving a little faster.
Yeah, yeah, a little bit faster, and then and then faster and faster. That's funny. Um, well, awesome. I mean, did we have any other items that like you wanted to hit on?
I think we covered a really good range here. I suspect at the pace things are going, there'll be more to talk about, and we should do it again as those new iterations come out and advancements come out. We should absolutely have another conversation.
Awesome. If we have any delightful medical students who I can empathize with very much, and they want to learn more about ScholarRx content, recommendations for them.
Yeah, absolutely. ScholarX.com, they can absolutely use our direct consumer product to help prepare, but they can also work with their institution to secure one of our institution agreements, where we can bring our content and capabilities to their medical program. So that's where we'd like to be involved, and hopefully they'll check us out. How about Prediction Health?
Yeah, so I mean, we're also pretty easy. It's predictionhealth.com. And physical therapists, occupational therapists, even like skilled nursing facilities have a lot of overlap. So they can always go there, learn more, and see how we can help. That's our mission. Try to make healthcare better and easier using AI.
All right. Well, this has been great, Pedro. Thank you.
Yeah, it was so much fun. We will definitely have to do it again. I love nerding out over AI stuff. So, any excuse is good.